Thought Cafe presents 7 Signs You Are Too Depressed to Do Anything. Do you ever have those days where even the thought of getting out of bed seems like an impossible task? Maybe you're feeling like you're stuck in a rut and can't seem to shake it off. Well, you might be dealing with more than just the regular blues. In this video, we're going to be discussing 7 signs that you might be too depressed to do anything. So grab a cup of coffee, sit back, and let's get into it. Number 1. You're feeling exhausted all the time. Feeling exhausted all the time is a common symptom of depression. Even if you're getting a full night's sleep, you might still feel like you can't get out of bed in the morning. It's not just physical tiredness either, you might feel emotionally drained as well. There are many possible reasons why depression can cause fatigue. For example, depression can disrupt the normal functioning of the body's stress response system, which can affect the body's energy levels. If you're experiencing persistent exhaustion, it's important to talk to a medical professional to rule out any underlying medical conditions. However, if there's no medical explanation for your fatigue, it might be a sign of depression. Number 2. You've lost interest in activities that you used to enjoy. Losing interest in activities that you used to enjoy is a common symptom of depression. It can feel like nothing brings you pleasure or satisfaction anymore, and you might find yourself withdrawing from activities that used to make you happy. This loss of interest can be especially frustrating because it can make you feel like you're not yourself anymore. You might feel like you're just going through the motions of your daily routine without any sense of enjoyment or purpose. There are many possible reasons why depression can cause a loss of interest in activities. For example, depression can affect the levels of certain neurotransmitters in the brain, which can alter the way you experience pleasure and reward. If you're experiencing a loss of interest in activities that used to bring you pleasure, it may be because of depression. There are many effective treatments available for depression, including therapy, medication, and lifestyle changes that can help you regain your sense of enjoyment and purpose. Number 3. You're having a hard time concentrating. Depression can affect your cognitive abilities and make it difficult to concentrate, remember things, and make decisions. You might find yourself struggling to focus on a task for more than a few minutes or forgetful about important details. This can make it hard to be productive at work or school, which can lead to feelings of frustration and low self-esteem. Even everyday tasks like getting dressed or preparing a meal can feel overwhelming when you're depressed. You might feel like you don't have the energy or motivation to complete these tasks, even though they seem simple to others. This can lead to a sense of helplessness and make it difficult to take care of yourself. If you're struggling with concentration and feeling overwhelmed, it's important to talk to a professional who can help you develop coping strategies and provide treatment options to manage your symptoms. Number 4. You're experiencing changes in your appetite. Depression can affect your appetite in a few different ways. Some people might lose their appetite completely and have little or no interest in food, while others might find themselves eating more than usual and craving high-calorie foods. When you're depressed, your body's levels of certain neurotransmitters like serotonin and dopamine can be imbalanced. These neurotransmitters play a role in regulating mood and appetite, so when they're disrupted, it can affect your eating habits. Some people might lose their appetite because they feel too sad or anxious to eat, or they might lose interest in activities they used to enjoy, like cooking or trying new foods. On the other hand, some people might turn to food as a source of comfort or distraction from their negative thoughts and feelings. Number 5. You're feeling hopeless or helpless. Depression can make you feel hopeless or helpless by affecting the way you perceive yourself and the world around you. When you're depressed, it can be difficult to see things in a positive light, and you might feel like nothing will ever get better. You might feel like you're trapped in a cycle of negative thoughts and feelings, and that there's no way out. This can make you feel powerless and helpless to change your situation, which can lead to feelings of hopelessness. Depression can also affect your self-esteem and make you feel like you're not good enough or that you're a burden to others. These negative thoughts can reinforce feelings of hopelessness and make it difficult to see a way out of your current situation. Number 6. You're isolating yourself from others and avoiding social situations. Depression can make you isolate yourself from others and avoid social situations by affecting the way you perceive yourself and the world around you. When you're depressed, it can be difficult to find joy or interest in activities you used to enjoy, including socializing with friends or family. Negative thoughts and feelings of worthlessness can reinforce the idea that you're better off alone and that no one wants to be around you. Isolating yourself from others can also be a way of coping with the overwhelming emotions that come with depression. You might feel like it's easier to manage your symptoms alone rather than risk being judged or rejected by others. It's important to remember that withdrawing from social situations is a common symptom of depression, and it's not a personal failing. However, avoiding social situations can make your depression worse and lead to feelings of loneliness and isolation. Number 7. You're experiencing physical symptoms like headaches, body aches, or digestive issues. When you're depressed, your body's stress response system can become overactive, which can lead to physical symptoms. For example, headaches can be caused by tension in your neck and shoulders, which can be a result of stress and anxiety. Body aches can also be caused by tension in your muscles, which can result from prolonged stress and anxiety. Digestive issues like nausea, diarrhea, or constipation can also be caused by depression. Remember, depression is a common mental health condition that affects millions of people worldwide. If you're experiencing any of these symptoms, it's important to reach out for help and support. A mental health professional can help you develop coping strategies and provide treatment options to manage your symptoms. They can also provide a safe space to talk about your feelings and provide support as you work through your depression. Thank you for watching. And if you like this video, then make sure to share it with others who are feeling these same symptoms. Take care of yourselves and remember that there's always hope for a brighter tomorrow.